Roxadustat treatment for anemia in patients undergoing long-term dialysis. Personal information: YouTube profile Emily Ponce, Twitter profile Emi Ponce 99, Facebook profile Emily Ponce Perez. Definition: Roxadustat is an oral hypoxia-inducible factor prolyl hydroxylase inhibitor that stimulates erythropoiesis and regulates iron metabolism.
Well, the data that were just presented yesterday and today represent the phase 3 studies of Roxadustat, which is one of this class of hip stabilizers. It's the first to market in over 9,000 patients worldwide. And there were basically three populations of patients that were studied. There were non-dialysis patients with chronic kidney disease. There were incident dialysis patients, most of whom had not previously required or not previously been treated with ESAs, and then were randomized to either an ESA or Roxadustat. And then there was prevalent dialysis patients that were converted from an ESA to either Roxadustat or continued on the ESA. And the pooled data as well as the individual populations were presented today. The results were very, very satisfying. The Roxadustat demonstrated superiority to placebo, which is the comparator in the non-dialysis population, both in terms of efficacy and comparable safety. So there were no safety signals compared to placebo in the non-dialysis population, which had placebo as the comparator. And for those of us who are concerned about the MACE outcomes that have been described with the ESAs, non-inferiority to placebo is pretty much as good as you can get in terms of safety. So this is very reassuring for us who are concerned that the class of hip stabilizers, and perhaps Roxadustat, the first one that has completed its long-term trials, might be also have similar safety signals like with MACE, major adverse cardiovascular endpoints. But that did not seem to be the case when compared to placebo. In the dialysis patients, both the incident and the prevalent, the comparator was ESAs. And what we found was that there was comparable efficacy, actually it's a little superior efficacy to ESAs in those populations, and there was improved safety, that in the incident dialysis population in particular, there was a lower incidence of MACE and MACE plus outcomes, MACE outcomes plus hospitalization for heart failure and unstable angina in the incident dialysis patients. Now that was not seen in the entire dialysis sample, but since this was basically an event-based outcome, you're going to have a more vulnerable population, meaning the incident dialysis patients having more events. And that's probably why they were able to detect the difference in events and a superiority in safety in the incident dialysis patients that was not detected in the prevalent dialysis patients, because in the prevalent dialysis patients, the event rate was just much lower.
Application in medicine. Roxadustat VH4592 is a potent, reversible HIF prolyl hydroxylase inhibitor that mimics the natural response to hypoxia. The intermittent dosing strategy with Roxadustat for the treatment of anemia 17 in patients with chronic kidney disease was developed to permit durable maintenance on effect.
You need your kidneys to live. It's obviously very important. Unfortunately, some people lose their kidney function. It's either due to chronic illnesses. The most common form of chronic kidney disease in America is diabetic kidney disease. In addition to that, people lose their kidney function acutely, suddenly, due to a catastrophic illness or some intermittent reversible illness. When that happens, people need acute dialysis as a life-saving treatment to allow them to have a reversal of their acute medical problems and survive. The dialysis is typically done either in the intensive care unit or here in the inpatient dialysis clinic at Piedmont Hospital. Often dialysis is a bridge to transplantation, and people on dialysis are often on the kidney transplant waiting list, and hopefully at one point in the future will get a kidney transplant either from a family member or a loved one, or alternatively through the deceased donor kidney waiting list. Dialysis is done typically in two different ways. The most common way it's done is a treatment called hemodialysis. Hemo refers to blood. So in this treatment, blood is removed from the body, treated through a dialysis kidney filter, and then returned back to the body. People on this treatment can have a normal daily lifestyle. They are able to participate in their normal daily family activities. A lot of people on this treatment can go to work on a regular basis and are able to have a good quality of life. The second form of dialysis is called peritoneal dialysis. So peritoneal dialysis allows people to do the dialysis treatments in their own home. The treatment involves using your own body, using the peritoneal cavity to do the dialysis. Fluid in the peritoneal membrane can be exchanged to remove kidney poisons and extra fluid, and therefore allows the individual to replace their kidney function and restores them to good health and normal daily activities.
Pros and cons. Pros. Intermittent dosing strategy with Roxadustat for the treatment of anemia, 17 in patients with chronic kidney disease, was developed to permit durable maintenance on effects. Cons. Studies link the use of high-dose erythropoiesis-stimulating agents to increase risk of cardiovascular events and death.
Anemia in chronic kidney disease is a potentially serious medical condition in which patients have low levels of hemoglobin, a protein that carries oxygen to cells throughout the body. Millions of CKD patients in China and the US experience this condition. For severe CKD patients, their anemia can increase the risk of heart disease, stroke, and hospitalization. We asked 1,000 CKD patients about their perceptions and experiences of anemia in CKD. Patients in our survey found that anemia in CKD has a big impact on daily life for patients, including feelings of sadness. In both the US and China, many of the patients surveyed are also unaware of what common symptoms to look out for, including headaches and difficulty breathing. Discussing and tracking hemoglobin levels is an important aspect of disease management. But our survey found that many patients need more support to understand their hemoglobin levels, and patients would like more information. So, what if we started having more conversations about the potentially serious risks of anemia in CKD? Those patients we surveyed who felt more confident were more likely to be informed by their healthcare professional of the symptoms, impact on daily life, and severity and impact of anemia in CKD if left untreated. CKD patients should feel supported to take a more active role in managing their anemia. At AstraZeneca, we put patients first. We are committed to listening to the patient voice to improve outcomes.
Issue applying Ecuador. Treatment with Roxadustat for 24 weeks in patients with dialysis corrects anemia, regardless of inflammation and parameters of iron metabolism. It is necessary to know these treatments to be able to implement in Ecuador to improve the quality of life of the patients.
A master of multitasking inside the human body? And there are two of them? Oh, I know. It's the kidneys. For human beings, they're essential to survival. In fact, the kidneys are small biological marvels. They produce urine, thereby removing excess water and toxins, produce hormones, regulate mineral levels and blood pressure, make vitamin D, and maintain the body's acid-base balance. Every day, these versatile organs cleanse all the body's blood, about 300 times. If the kidneys become diseased or fail, it's a serious health problem, because excess water and waste products from the body's metabolism can no longer be filtered out of the blood. To prevent toxins from accumulating, the blood must now be regularly cleansed with the help of dialysis. The most widely used form of dialysis therapy is called hemodialysis. At the center of hemodialysis is a dialysis filter, known as a dialyzer. Serving as an artificial kidney, it cleanses the patient's blood during the treatment. Inside a plastic tube 30 centimeters long, about 12 inches, the blood flows through up to 20,000 hair-fine fibers. Microscopic pores in the fibers filter out metabolic waste and excess water, which the dialysis fluid then carries away. As the blood cleansing process proceeds inside the dialyzer, a dialysis machine pumps the blood, administers anticoagulants, and monitors circulation. A treatment can take from 3 to 6 hours, usually 3 times a week. Chronic kidney failure afflicts more than 3 million people worldwide. Most require life-saving dialysis treatment. Fresenius Medical Care is the world leader in dialysis. About half of all dialyzers and dialysis machines sold worldwide are made in our plants. In our more than 3,500 dialysis clinics, we treat over 300,000 patients. Every 0.7 seconds, we start a dialysis treatment for a patient somewhere in the world. We are giving patients with chronic kidney failure a future worth living and the best possible quality of life. Fresenius Medical Care.
Conclusion. To sum up, compared with other parenteral drugs for anemia, Roxadustat has a good desired therapeutic effect and can help the patient in erythrocyte replacement.
Some areas of tumors are badly vascularized and consequently are poorly oxygenated or hypoxic. Significant tumor hypoxia is therefore present in about half of solid human tumors and is associated with unfavorable patient prognosis. This is because hypoxic cells are more malignant and resistant to most standard treatments, including immunotherapy. On the other hand, hypoxia is arguably one of the best validated targets in oncology, making it ideal for guided drug delivery. This is the so-called hypoxia-activated prodrugs, or HAPs, an elegant approach that consists of using a drug specifically activated under hypoxia within the tumor. However, a number of such prodrugs have recently failed to demonstrate efficacy in pivotal clinical trials, and one of the reasons for that is the lack of patient selection. Our analysis of the preclinical data shows that selection of potentially responsive tumors based on hypoxia status only was imprecise and insufficient. To overcome this limitation, we propose to extend an existing published mathematical model which accurately predicts the effect of our proprietary hypoxia-activated prodrug by integrating the following: pharmacokinetic features of the HAP and its activated metabolite, the level of tumor hypoxia, the activity of nitroreductases able to activate the prodrug, the inherent sensitivity to the warhead of the HAP, This biomakers-based companion predictive model will be trained on existing data with spheroids and human tumor xenografts, and then validated on external datasets and in specific experiments. The project aims to develop a complete multifactorial companion biomarker which will allow in silico simulation and optimization of protocols with HAPs, precision selection of patients likely to respond to the treatment, customization of the HAP dose for each individual patient. This approach will be a breakthrough in drug development that is unprecedented and will be used for several hypoxia-targeting drugs. It will become a commercially viable product by itself, increase the likelihood of success in drug development, and be a major asset for the company and the participating university.
That's it. Thank you.